We wanted to bring you all the absolute latest in terms of what you need to know about the coronavirus pandemic today. So let's start with the basics, which is just how many cases are out there, both here and around the world. So in the U.S., the number of coronavirus cases has jumped up to 35,418. There have been 473 deaths. Meanwhile, worldwide, we're up to 349,807 cases. That's around the globe. And Saagar, New York has really become the epicenter in the U.S. of coronavirus, with 15,000 cases in New York State alone.
Right, and just to give some context on that, we can learn a lot about what's happening in New York State. 1 in 8 patients in New York has been hospitalized. 114 people in the state have died as of Sunday morning. And through really what it is that New York City in particular has become a major vector of transmission. The governor of Cuomo said that most of the deceased from the coronavirus are over the age of 70. But I think it's important that we highlight that that doesn't mean necessarily that those are the people who are getting this. We're seeing a large rise in the number of males in particular below the age of 45 who have conducted coronavirus. According to Dr. Birx from over the CDC, briefing the White House press podium, that males are 3 times more likely to die from the coronavirus than females. And overall, what we're seeing is that the people who are becoming infected with the virus are not necessarily of the elderly population. We still see hospitalization rates in their semi-high numbers for people who are below 50, between the 18 to 49 demographic. So all of us need to remain vigilant at this time.
In fact, in New York, the largest number of hospitalizations has actually been for men under the age of 50. So we just want people to know that even if you are not an elderly person, first of all, if you are an elderly person, be extremely cautious. But even if you are not, people are getting very, very sick with this, even if they're relatively young.
Someone I know is in his mid-40s. He's got a ventilator. He's on a ventilator with a tube down his throat right now, fighting for his life. But the other thing I wanted to talk about here is about the steps in order to contain the virus. And this is something that right now we're all in a period of social distancing. We're all in a period in which we're trying to contemplate how do we eventually go back to life as we know it.
Right. How does this end?
And how does this end? The truth is that it can't just end right now immediately. And we'll get to some of that later. But I think what the New York Times and some others have been trying to highlight are what are the harsh steps out of Asia that led to them not having to shut down their entire retail economy. I mean, China is back up to the point where people are back in their malls. They don't have the same level of shutdown that we have here in the United States. Singapore, Hong Kong, Taiwan, and South Korea as well. South Korea in particular is the real gold standard, in my opinion. And what they've been able to do is high availability testing, is that they have a low criteria for the number of people who are tested, and they have, more importantly, the amount of tests needed in order to test all of those people rapidly. What they've also done is they have very clear quarantine and isolation protocols. So what they do is that they will basically, they have stringent standards. If you've been tested, you can't even leave your house for 14 days. And if you test positive, then they have a very strict isolation and quarantine procedures in which you won't come into contact with anyone else. And the other important thing that they do is something called extensive contact tracing.
Yes.
81% of coronavirus cases in South Korea came from clusters. And what clusters mean are a gym, a workplace. Is it one person, or in New Rochelle, New York, is where that originally cluster emerged. So what you can do is you aggressively test, you find somebody, and maybe you identify the clusters, and then you ruthlessly lock down that cluster into quarantine so they can't go out and spread the virus to others in their social network. And it requires, some people in America are going to have to understand this, is that this is going to require large government intervention. And what they're doing in the case of like Taiwan is using the GPS on your phone in order to make sure that you're not violating quarantine, and they can track who's been interacting with whom.
A lot of these countries fever test everywhere.
Yes.
Like walking into the grocery store, walking into the subway, wherever you're going, they're checking your temperature and making sure that you're at a normal level. But your point about testing is so important. Public health officials here are saying, don't get tested if you're asymptomatic for sure. Don't get tested if you don't have the classic symptoms, if you don't have that travel pattern, etc. But ultimately, where we need to get to, if we're going to be able to reopen the economy, is having enough tests available where everyone is getting tested, who is even expected. Because why? Well, the reason we have to have basically a nationwide, population-wide shutdown right now is because we don't know where those clusters are.
Yep.
We don't know who's been in contact, who needs to be quarantined, how we can isolate. Because if you can identify and isolate those individual groups, then yes, it becomes safer to go back to work. It becomes safer to go back into the stores. But when you are flying blind, essentially, which is where we are now, that is not a possibility.
No,
great article in New York Times where they interviewed a lot of experts with some very specific learnings about what needs to be done to be able to bring this thing to heel as quickly as possible. And basically, the bottom line is shut everything down, test everyone, and then you can move from there.
Yeah, exactly. At the same time, the president, these are reports breaking now, that the president is essentially considering a pivot towards the economy. Is that the advisors in the White House are concerned that they've listened too much to the doctors saying that everything should be shut down at this period. And I sympathize with that. I really do understand, which is that they feel like, look, we shut this thing down, we can't keep this forever, etc. And you know what? I agree. But in order to do that, in order to get the economy open again, we need the industrial capacity to produce the gowns and masks and all the protective personal equipment that our doctors are going to need. And most importantly, we need the testing capability, because if we let everybody out basically right now, we're going to overwhelm the healthcare system, and millions possibly could die in this country because it would just spread the virus. So the only way to get back is, I know it's frustrating to people who are watching unemployment tick up. It's okay. We have the fiscal stimulus package. We have the ability to pump money into the economy. This is what emergency funds were made for right during this period, a couple of weeks. And during that couple of weeks, it needs to be paired with one of the greatest mobilizations of government that this country has ever seen in order to respond for testing and for all of that. Because otherwise, if we let people out of this, if we let people out, it'll be a catastrophe.
Well, here's the reality. If you could, this is impossible, but if you could shut everything down for 14 days, where everybody literally stays 6 feet away from everyone else and just stays in their house, it would be over. Because that's how long.
Didn't touch anything.
Don't touch anything. Don't, everything would die on the surfaces. Everything would run its course. It would be over. Obviously, that's not realistic. But the point is that the closer we can get to that total shutdown as quickly as possible, the less pain we're going to have in the long term. Because if we start going back out, if we start reopening the economy and telling people it's okay to go back to work, what you do, you don't end the pain, you just prolong it.
Yeah.
And you're still going to have massive economic effects because people are concerned about their health. They're staying home. They're not shopping anyway. A lot of the lack of activity right now isn't because the federal government is shutting everything down. It's because people want to be responsible. They want to be safe, and they want their families to be safe. So I understand and I sympathize with that as well. I'm sure a lot of you are out there thinking too, like, is this really worse than what would happen if we just let this thing run its course? The reality is you have to go through this, and the more aggressive you can be in the short term, the quicker we can get out of this on the other side. And just to underscore, and this is really significant, how widespread this has become and how it's impacting every level of government. We now know First Senator Rand Paul has tested positive for coronavirus. A number of other senators who were in contact with him are now quarantined, so they're having to miss votes at obviously a critical time. And of course, we're praying and concerned and thinking about their health as well. There are some reports that Rand Paul had been using some of the common areas over on the Senate side.
I can't use my apartment gym, but apparently the United States senators who are responsible for, taking care of all of us.
Not great, guys.
Their fitness facilities that are open.
And at the same time, Ben McAdams, who's a congressman from Utah, has tested positive, and he is now in the hospital. So this has become very serious for him. So look, this impacts everyone. No one is safe from this, no matter how much power or money or whatever you have. Everyone is potentially impacted, and it's a scary thing to see our lawmakers, who we do need during this time, love them or not, need to be there, able to cast important votes and make important decisions at this moment.
Yeah, it's time to, you need to have your behavior exhibit what we need the public to be doing. And we also need to have our response reflect what the public needs right now.
Absolutely. Yeah. All right, we're going to have more Rising for you after this.